All right, so let's start with the muscles of the upper limb. We're traveling down the arm, and now we're in the area of the forearm flexors, extensors. Remember, pronation means going down. Supination is bringing your hand up, like asking for soup. Pronation is coming down, like bouncing a ball. And we'll discuss some of the movements that move our wrist and our hand. So first of all, let's look at this little group here, forearm flexors, okay? So if you could see the image here, forearm flexors is, like for example, this movement, we're flexing our elbow. See this little trio here? Right here. Kind of makes like a little L here. So the first one is called the biceps brachii. We've discussed this in the past. And then behind it is the brachialis. So there is a layering effect. Biceps brachii is the most superficial. Brachialis is underneath it. And then the brachioradialis kind of extends from the humerus to the radius. Okay, so let's look at this in more detail. So let's start with the biceps brachii. So if you go to page 70, well, it's on page 72 where it says forearm flexors. So first of all, when we call it the biceps brachii, bi means it has two heads. There's a short head, you can see that in green. It's going to originate on that coracoid process of the scapula. And then there's a long head in red. It's going to originate along the supraglenoid tubercle of the scapula. Both of these are going to insert on that radial tuberosity. And what is the action? The action is the flexion of the elbow and also supination of the forearm. It's going to bring it like asking for soup. Another effect is it's going to help stabilize the shoulder, and nerve is the musculocutaneous nerve, okay? So we kind of mentioned in the past that when you have to memorize a lot of groups of muscles, sometimes putting things in compartments makes it simpler. So for example, in these anterior forearm muscles, there's three. We talked about the coracobrachialis last time, the biceps brachii, and then one underneath it is the brachialis. They're all going to be musculocutaneous nerve. So if we could pull this muscle off here, the next muscle underneath it here, I hope you could see the layering effect, is called the brachialis. So the brachialis would be underneath the biceps brachii. This one's going to originate along the humerus. And this is going to insert along the ulna, not the radius. It's going to insert on the ulna tuberosity and the coracoid process of the ulna. This one also is going to flex the elbow. It somewhat assists the biceps brachii, but you could see the layering here. This is the muscle we're talking about. And again, this is one of the other muscles that we talked about, which is the musculocutaneous nerve. All of these are listed on page 72 in your class notes. You could look at those, origin, insertion, and action. And the third one is the brachioradialis. And the name kind of tells us what it does. It starts in the brachium. It's going to start along the distal end of the humerus. And this one's going to insert along the styloid process of the radius. This muscle is actually considered a posterior muscle because it's kind of located along this area. And we'll learn shortly all of the muscles along the posterior portion of the upper limb are going to be the radial nerve or branches of the radial nerve. So it's posterior to the humerus, the radius, and the ulna. All those muscles, we call that the posterior compartment, are going to be radial nerve or branches of the radial nerve. So the brachioradialis, we have to know that the action is elbow flexion. The nerve is the radius. So now we go to the posterior portion of the upper limb, and we've got another muscle. It's called the triceps brachii. So that tri means three. It has three heads. So we have a long head right here in the green. This originates along the infraglenoid tubercle of the scapula. Remember, the origination does not move. The insertion is the region that moves. We have a lateral head, and this is going to originate along the lateral and posterior surfaces of the humerus. And then here's the lateral head. And then we have a medial head, which is going to originate also on the lateral surface of the humerus. All of these are going to be recognizable because they're going to insert along the olecranon process of the ulna. Okay, remember that's that little bony, like if you flex your elbow, that bone. So the triceps brachii is located in the back posterior to the humerus. And with contraction, what it does, it's going to extend our elbow. So it's the major extensor of our elbow. And because all of these posterior compartment muscles are radial nerve or branches of the radial nerve, we know the innervation. Okay, so just reviewing, anterior compartment, mainly flexion of the elbow. We have the coracobrachialis, biceps brachii, and brachialis. They're all musculocutaneous nerve. Posterior compartment, which is elbow extension, is the triceps muscle, and that's the radial nerve. Okay, so we can see it here on a model. Here's our triceps brachii, and what's going to make it recognizable, here's our olecranon process of the ulna. It's going to insert there, and it's also going to be recognizable because on a model it's going to be in the posterior compartment. So here we can see it in blue. These are images from visible body. So you can see here's the humerus, here's the triceps brachii. It's going to insert into that olecranon process, and when it contracts, it's going to cause elbow extension. And we know because it's in that posterior compartment, it's the radial nerve. So there is another small little muscle here. It's called the anconeus. You could see it right here, which is also considered an elbow extensor. We will not see it. It's very small. It's underneath other muscles, so we don't really see it on a model, or definitely not on the cadaver. So this one's going to originate along the lateral epicondyle of the humerus. Remember, the epicondyles are the lateral would be always in anatomical position. So lateral would be the epicondyle face out versus the one in. And then because it's in that posterior compartment, it's a radial nerve, and it actually assists the triceps brachii in extension. So we're talking about movements and groups. So antebrachium pronator. So remember we discussed how this is the brachium right here where the humerus, and then the antebrachium, the bones in there are the radius and the ulna. Okay, so just to review that, remember the radius is lateral, the ulna is medial. We always go back to anatomical position. So we discussed the movement, the pronators. Pronator is like bouncing a ball. We're kind of internally rotating our wrist to like bounce a ball. That movement is called pronation. So we have two pronator muscles. One is called the pronator teres. Okay, you can see it right here. And the other one is right here. It kind of looks like a square. It's called the pronator quadratus. So the pronator teres is going to originate along that medial epicondyle of the humerus. So if you palpate your own humerus, the medial epicondyle is going to be that little knob we feel more medial. right along the distal portion of the humerus. The pronator teres, if we take our thumb and put it this way, it kind of crosses our elbow. So it's going to originate along that medial epicondyle of the humerus. And this is going to insert into the radius, okay? So when it inserts into the radius, when it contracts, it's going to pull your radius over the ulna and pronate your antebrachium. So we'll talk about another nerve here. All the nerves in here are going to be median nerve, okay? So we already talked about how this compartment here, antebrachium, musculocutaneous. Everything in that posterior compartment, radial. Most in this compartment, which is the anterior portion of the antebrachium, are going to be median, except there's two exceptions, which we'll talk about. So right here, the pronator teres is the yellow one right here, okay? We can see it on a model right here. It originates on the medial epicondyle, and it's going to insert into the radius, so it's going to pull the radius down, causing pronation, okay? There is a pronator quadratus. It kind of looks like a square here. This one's going to originate along the ulna, and it has to insert on the radius in order for it to pronate. And because this one's located in that anterior antebrachium region, that is a medial nerve, okay? Again, this pronator quadratus is really deep underneath all of those antebrachium flexor muscles, so we normally would not see it. It is one of the two pronators. There is a deep supinator. So remember, supination means lifting your hand up, like asking for soup. This one originates along the lateral epicondyle of the humerus. It's going to insert into the radius. With contraction, it's going to supinate. And again, this is very deep. We normally would not see that, considered a posterior muscle. So it's a radial nerve. So this is where we get into a little more detail, okay? So memorizing this area, which is your forearm flexors and extensors, the muscles are a little more, they're smaller and there's more of them. So it could be a little tricky, and we'll go over this in lab again and hopefully clear this up. So in the front here, in the anterior portion and anterior, these are considered wrist flexors. Because if you flex your wrist, remember wrist flexion is this movement like this. So in this anterior portion, flex your wrist. The muscles in that posterior portion of your forearm extend the wrist, okay? So this group here in the front, we call wrist flexors. And the muscles in the posterior compartment are wrist extensors, okay? So let's move on to the next group here. So here's a key. All of these wrist flexors, they're going to originate along the medial epicondyle of the humerus, okay? If you put your thumb right here on the medial epicondyle and you put your fingers across here, this is kind of a way to memorize all the names of these muscles. All the wrist extensors are going to originate along the lateral epicondyle, okay? So often when memorizing origin, insertion, action, nerve, again, if you compartmentalize these muscles, it will be easier to memorize. So medial epicondyle, all the wrist flexors originate along the medial epicondyle, and the wrist extensors, they're all going to originate along the lateral epicondyle. So let's talk about the muscles of this antebrachium. Often the name gives you a lot of information, okay? So when they say flexors, okay, wrist flexors, they're going to be in the front. That's how I memorize things, okay? And then the wrist extensors are going to be in the posterior, the back, okay? The other thing that's going to give them away, so is the flexor, okay? Most of them have flexors. Some of them don't, like the palmaris longus. Flexor, right? So we know it's in that anterior compartment. What else do we know about it? It originates along the medial epicondyle. It's going to the carpals, and it's on the radial side. That's how we're going to know how to break down these names. The other one is flexor, carpi, going to the carpals, but it's on the ulnar side. So the radial side, remember, it's lateral, and ulna is medial. And there's a muscle that travels in the right in the center, and that's called the palmaris longus. If you bring your fifth and first digits together in this position, the palmaris longus sticks out. There's like, I think 15% of the population that doesn't have this muscle. If you flex your wrist and do this, it'll pop out. The reason it pops out because it travels on top of that flexor retinaculum. But the palmaris longus is one of the flexor muscles, okay? So we know it originates along the medial epicondyle. We know they all flex the wrist. The radialis is more on the radial side. The ulnaris is on the ulnar side, and the palmaris longus goes down the center. What else do we know about these? We know they all originate along the medial epicondyle of the humerus. Okay, so we know all of these flexors are going to be in the front, and they originate on the medial epicondyle. The extensors are on the back, and again, same thing, extensor, it extends the wrist, goes to the carpals on the radial side. There's two on this radial side. There's an extensor, carpi radialis longus, and radialis brevis. And then there's an extensor on the ulnaris side, okay? So what do we know about these? So first of all, we know that these flexors are going to originate along the medial epicondyle, and we know the extensors are going to originate on the lateral epicondyle. We know that. We know these three muscles are going to flex the wrist. We know the 4, 5, and 6 are going to extend the wrist. What else do we know? We know these are located in the back or the posterior portion of the antebrachium, so they're all going to be radial nerve. We already talked about how most of these are going to be median nerve, okay? This is the exception. There's 1.5 exceptions in this antebrachium that are ulnar nerve, and this is the one of these exceptions. So the name tells you that exception. It's flexor carpi ulnaris. So this one's going to be the ulnar nerve. So let's talk about the flexors first. Okay, so you could follow along with these images. Go to page 54 on your lab manuals. We're going to go over this in lab. I know it seems a little overwhelming because it's a little difficult. So when we talk about the forearm flexors, right, we know one thing originates, all going to be originate medial epicondyle. And the name of these muscles kind of tell you where they insert, right? Remember, origin is non-movable, insertion is the movable. So when that contracts, they're going to cause the wrist to flex and then also add additional movements, which we'll talk about. The thing that we can't express to you is that there's a layering. There's 4 superficial flexors. If we could pull those up, 1 middle flexor and then 3 deep flexors, okay? So let's start with the 4 superficial flexors. So first of all, if you put your thumb along the medial epicondyle, and then you put your 1, 2, 3, 4 over your forearm. And they kind of follow a pattern. So the first one here is called the pronator teres. These are all the most superficial layers. The next one is this one. It's called the flexor carpi radialis. And you can see how this muscle is going to the radial side of the carpal. So it's flexor side, carpi radialis. The next one is that palmaris longus. It's kind of in between, and you can see how it goes over that flexor retinaculum. And then the last one is the flexor carpi ulnaris. Okay. So if you put your thumb right over your medial epicondyle, they're kind of in that order. So the first one here is the flexor carpi, pronator teres, flexor carpi radialis, palmaris longus, flexor carpi ulnaris. Okay, so what do we know about them? We know they all originate along that medial epicondyle. We also know the nerve, right? This is the medial epicondyle. We know the nerve, they're all median, except for the flexor carpi ulnaris, which is going to be ulnar, all right? So then if we pulled that layer up, and what do those muscles do? They're going to pretty much flex the wrist, correct? So the palmaris longus, which is this one in the center, that one's all wrist flexion, okay? That makes sense. It's just going to flex the wrist. The other two, let's talk about the flexor carpi radialis first. So flexor carpi radialis, it's on the radial side. So when this contracts, it's going to flex the wrist, but also abduct the wrist because it's on the radial side. So anytime it's on the radial side, these forearm flexors and extensors, it's going to flex, but also abduct. The flexor carpi ulnaris is going to flex the wrist, but also adduct because it's going to pull it medially, all right? So then we have one deep layer. Okay, so if we could pull these four muscles up, the next one is called the flexor digitorum superficialis. So that muscle goes all the way into the digits, and it's flexing our phalanges. And there's a superficial layer. Then if we pull that one up, so the flexor digitorum superficialis is going to insert into the proximal interphalangeal joint. We call that our bye-bye muscle because it pulls our phalanges so we can say bye-bye, okay? The flexor digitorum profundus goes to the tips of the distal interphalangeal joint, so that allows us to make a fist, okay? So let's go over these in detail. I know you're a little overwhelmed. So again, we have the four superficial layer muscles. I like this mnemonic: pass, fail, pass, fail. So if you put your thumb into the medial epicondyle, and then it's pass, fail, pass, fail. So the first one in yellow is the pronator teres. The next one is flexor carpi radialis. Okay. So remember, this is lateral. This is medial. The blue is that palmaris longus. This one's totally flexion of the wrist. Okay. And then we have in red the flexor carpi ulnaris. So that's the mnemonic: pass, fail, pass, fail. That's that superficial layer. They all originate along that medial epicondyle, right? We know they're all the median nerve. And the exception is the flexor carpi ulnaris. the name tells you, it's the ulnar nerve because it's more medial, and the ulnar nerve travels medially. So let's start with the origin of the pronator teres. Remember, they all originate on the medial epicondyle. It's to insert on the radius, and the action is pronation. The nerve is median nerve, which is this one right here. Okay. The flexor carpi radialis. So this one goes from the medial epicondyle. It's going to go into the radial side of the carpal bones. And because this is lateral, it's going to flex the wrist and also abduct because it's in that lateral compartment, okay? And we know that's the median nerve. The pars longus originates along the medial epicondyle, and it's going to insert into what we call the flexor retinaculum. It's kind of like a large tendon that exists in this region in the palmar surface of the hand. And this one, and it goes over that flexor retinaculum. And that's why if you bring your thumb and your fifth phalange together and flex your wrist, it pops out. You see, I don't know if you could see mine pops out. You could do that on your own and see it. So this one is straight wrist flexion because it's right in the middle. And this one is the median nerve. Okay. Then we have the lateral muscle, which is the flexor carpi ulnaris. Okay. So I'm sorry, the median nerve, medial muscle. So we know it's originate on the medial epicondyle. It's going to insert along the ulnar portion of the carpal bones. So this one, because it's medial, it's going to flex and abduct. And this is one of those exceptions. There's 1.5 muscles that are ulnar nerve. Everything else, remember, is median nerve. So then if we pull those muscles up, remember it's pass, fail, then we have the next muscle in, which is the flexor digitorum superficialis. So in this image here, you could see what it looks like on a model. You could see the 4 muscles we just talked about, the pass, fail. Here's the pronator teres. Here's the flexor carpi radialis, the palmaris longus, and this is the flexor carpi ulnaris. Underneath that here is that flexor digitorum superficialis. There's 2. There's the superficialis, and then there is the profundus. So the next layer down would be the flexor digitorum superficialis. So what that does, flexor, flex your digits. This one only goes into that proximal interphalangeal, so it's consider it the bi muscle. Okay. So this is going to originate, like all of them, along the medial epicondyle. It's going to the middle phalange, so it allows us to say bye-bye. The action is flexing our phalanges, and we know it's the median nerve. Okay, so we kind of know a lot if we compartmentalize all of these muscles in that anterior interbrachium. So if we pulled out that digitorum, we pulled that layer off, then we have that deeper layer, which is called the flexor digitorum profundus. So this one, same thing, flexes our digits, but it goes all to the tips. So it allows us to make a fist, curl fingers to make a fist. There's 2 other flexors in this area. We will not see them. They're really deep. And the name tells you what they do. One is called the flexor, right? It flexes. Make sure you understand pollicis means thumb. Okay, just from now on, call the thumb the pollicis, and there's a longus. So what does that do? It flexes our thumb. Okay. And then we talked about that really deep muscle called the pronator quadratus. What will we see? We could see in this image here, this muscle right here. Let me show you. This one right here is called the flexor digitorum profundus. Okay. On the models, it looks like this. You can see we pulled up all the top layer, the first four, we pulled up the flexor digitorum superficialis. Here's the flexor digitorum profundus. You'll recognize this because you could see how DR, because you could see all the nerves. So remember we talked about this flexor compartment, all median nerve, and there's 1.5 exceptions. The one exception was the flexor carpi ulnaris. The second exception is this muscle, flexor digitorum profundus. So this one is 1/2 median nerve and 1/2 ulnar nerve. So you can see here is the ulnar nerve. The yellow on these models are the nerves. The red are going to be the arteries, and blue would be the veins. So in this situation, this muscle here, which is that flexor digitorum profundus, 1/2 is going to be ulnar nerve innervated, and the other half is going to be median nerve innervation. So the flexor digitorum profundus, it's going to originate along the medial epicondyle, and this one's going to insert on the distal phalanges. So when it contracts, it's going to be like bringing your phalanges, curling them up to make a fist. So this is that exception I talked about. The medial part is going to be the ulnar nerve, and the lateral part is going to be the median nerve. The flexor pollicis longus, we will not see it, but it exists. It's going to originate along the radius, and it's going to insert on the base of the distal phalange. And what it does is it's going to flex our thumb, and it's a median nerve. All right. It's due this week, the Wiley Plus. All right, so let's move on to the extensors, okay? So the extensors are that posterior compartment, right? What do we know about it already? They're all going to originate on that lateral epicondyle. We know the nerve, they're all going to be radial nerve or branches of radial nerve. For this class, we're going to call them all radial nerve, okay? And we'll talk about the different muscle that exists here. So they're kind of in order. We just have to memorize the order when we look at the tendons. We already talked about the brachioradialis, okay? But then we start with all of these. They're all extensors, okay? So extensor tells you what they do, right? We know that there's two, they're all going to originate along that lateral epicondyle. They're all going to be radial nerve, right? We know a lot about these already. And we know they all extend the wrist, right? The other thing we will know, and just by looking at their names, is when there's two actually in this compartment. There's a radialis longus, which is the longer muscle, and then there's a radialis brevis, which is the shorter one. Remember, always go back to anatomical position. I don't know if you can see me. It's with the palms facing forward. So when they're on the radial side, right, we already talked about how they're going to extend the wrist and also abduct, right? So if they're going to pull the wrist away. We know extensor digitorum, based on the past, they're going to extend the digits. The other thing we're also going to know, digiti minimi. Digiti minimi is going to extend the fifth phalanges, like little pinky, okay? We already know extensor carpi ulnaris. On the ulnar side, it's going to extend the wrist, but also, because it's medial, it's going to adduct, okay? So let's talk about these in detail. So first of all, on the model, which probably will be the way you'll be tested, we have to know the order. So the first one is the brachioradialis, which we talked about already. The brachioradialis, it's kind of, if you bend your elbow, it's the muscle that travels in that lateral portion, okay? But it's not part of this compartment, but it is part of that posterior compartment. And then we start with the next one, which is the extensor carpi radialis longus. And then we have the extensor carpi radialis brevis. Okay, they're right next to each other, going to the radial side of the carpals. So we know based on that, it's going to extend the wrist, but also abduct the wrist. Does that make sense? And the next one is extensor digitorum. So this one is going, it's this one right here, going to all the four digits. What it's going to do is extend the digits. Okay, so we call it the extensor digitorum. We have the next one, and they're all in a row, going to the fifth that's called the extensor digiti minimi, or the pinky. And then the last one is the extensor carpi ulnaris, and that's going to extend the wrist and adduct. Okay. So let's look at each of these individually. So the extensor carpi radialis tells us where it's going. It's going to the carpal region on the radial side, on that extensor surface, so it's posterior. We know all of these are going to originate along the lateral epicondyle. This one is going to the metacarpals on the radial side, right? There's two versions of this. There's the longus and the brevis. They're both doing the same thing. So this one, because it's located laterally, it's going to extend the wrist and abduct the wrist. And we know all of these in the posterior compartment is the radial nerve, okay? There's a brevis. There's a smaller one right next to it. Again, it's going to originate the lateral epicondyle. It's going to the base of the third metacarpal on the radial side. Because it's located laterally, it's going to extend an abduct. It's also radial nerve because it's in that posterior compartment. On the other end, going to the ulnar, right, again, originates lateral epicondyle. We know it's radial nerve, okay. We know because this one's located laterally, it's going to extend, it's located medially, I'm sorry. It's going to extend and abduct. Extensor digitorum. So this tells you everything, okay? It's originate the lateral epicondyle. It's going to insert into the 2 through 5 phalanges. So what does it do? It's going to extend the phalanges, extends the fingers, okay? And this is also the radial nerve. Extensor digiti minimi. Again, the name tells you everything. We know it, all of them are going to originate that lateral epicondyle. This one's going to go into the 5th phalange, so that's why we call it small digit, digiti minimi. It's going to extend it. It's radial nerve. All right. So again, there are muscles that are going to move the details that move the fingers. We talked about the flexor digitorum superficialis, the flexor pollicis is going to flex the thumb. Flexor digitorum profundus is also going to flex the digits. Extensor digitorum extends the digits. Extensor digiti minima is going to extend the pinky. These are extensors associated with the thumb, extensor pollicis longus and brevis. Extensor indices extends the index finger. I wouldn't really put a lot of attention on all these other than the ones we passed. So there are a couple of muscles in this area. One is called the adductor pollicis longus, which adducts the thumb. Remember, thumb adduction would be pulling the thumb away from the midline by doing this. That would be called the adductor pollicis longus. This is going to originate on the ulna and insert on the first metacarpal, and the action is adduction. And because it's considered posterior, it's part of the radial nerve. There's an adductor pollicis longus and adductor pollicis brevis. Again, they're going to both extend. Extensor pollicis longus, extensor pollicis brevis. They both extend the thumb, considered in that posterior surface. There's another muscle that we don't see because it's deep, and that's called the extensor indicis.